When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed-sponsored jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Hi, my name's Alex Conway. I'm a fourth-year medical student at Kaiser School of Medicine, and these are ophthalmology questions 1 through 3. Ophthalmology question 1. A 70-year-old man presents to the clinic for decreased visual acuity in both eyes. The patient has been having problems driving at night over the past 6 to 8 months and has noticed haziness in his vision as well. He denies any diplopia, double vision, dizziness, headache, or vertigo. The patient also denies any eye pain, tenderness, or sensitivity to light. The patient has not noticed any eye floaters or flashing lights. His other medical problems are hypertension and benign prostatic hypertrophy. The patient does regularly see an optometrist for presbyopia, or age-related farsightedness, and gets screened annually for glaucoma with non-contact tonometry. Which of the following is the most likely diagnosis based on this history? A. Anterior uveitis. B. Open-angle glaucoma. C. Retinal detachment. D. Cataracts. Or E. Closed-angle glaucoma. The correct answer is D. Cataracts. The patient is most likely suffering from cataracts. Cataracts present with painless opacification of lens, which results in decreased vision. Uveitis is an inflammation of the uvea and is typically associated with systemic inflammatory disorders, such as rheumatoid arthritis, sarcoidosis, and HLA-B27-associated conditions. Open-angle, chronic, and closed-angle, acute, glaucoma happen when the optic disc is compressed, secondary to increased intraocular pressure, resulting in vision loss. Retinal detachment is the separation of the neurosensory layer of the retina from the outermost pigmented epithelium. It presents suddenly with flashes and floaters, as well as monocular loss of vision, as a curtain is drawn down. It is a surgical emergency. Ophthalmology question 2. A 4-day-old newborn boy presents to the emergency department for evaluation of ocular discharge, which his mother first noticed 2 days ago. The boy was born at 40 weeks gestation at home and did not receive erythromycin eye drops, the hepatitis B vaccine, or vitamin K injection. Physical examination reveals bilateral, profuse, purulent discharge with significant conjunctival injection and eyelid edema. Which of the following treatments is indicated for treatment of this newborn's condition? A. Artificial tears. B. Intramuscular ceftriaxone. C. Oral erythromycin. D. Reassurance. Or E. Warm compresses. The correct answer is B. Intramuscular ceftriaxone. This newborn is likely suffering from gonococcal conjunctivitis, which typically presents between days 2 and 5 of life. While erythromycin eye drops at the time of birth helps to prevent gonococcal conjunctivitis, treatment is with an intramuscular or intravenous third-generation cephalosporin, such as ceftriaxone, cefotaxime, or ceftazidime. Answer choice A, artificial tears, is incorrect. Artificial tears can be beneficial in treating chemical conjunctivitis, which can result from antibiotic eye drops given to newborns. This is more likely to present in the first 24 hours of life. Purulent eye discharge would be unusual in chemical conjunctivitis. Answer choice C, oral erythromycin, is incorrect. This is a preferred treatment for chlamydial conjunctivitis, which is more likely to present between days 4 and 15 of life. Discharge is typically watery, though it may become mucopurulent over time. Answer choice D, reassurance, is incorrect. This newborn's eyelid edema, profuse purulent discharge, and conjunctival injection do warrant intervention. Untreated gonococcal conjunctivitis can result in permanent corneal scarring and/or vision loss. Answer choice E, warm compresses, is incorrect. A warm compress can be helpful in management of an external hordeolum or sty and/or as palliative therapy for viral conjunctivitis. It would be insufficient to treat gonococcal conjunctivitis. Key learning point. Newborn gonococcal conjunctivitis presents between days 2 and 5 of life and is characterized by significant eyelid edema, conjunctival injection, and purulent discharge. Treatment is with an intramuscular or intravenous third-generation cephalosporin.
In Walmart's Hulu'ville, time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego flowers, they could check off their lists in as fast as an hour. All of Hulu'ville, East, West, South, and North, could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart, who knew? Subject to availability, terms and fees apply.
Abercrombie Kids is bringing the cheer all holiday season, and the gifts too. No matter how long their wish list is, there's always room for just one more. Whether it's a new winter coat, an extra pair of jeans, or cozy matching sweat sets, get gifting with looks they've been waiting for all year. Shop Abercrombie Kids in the app, online, and in stores.
Ophthalmology question 3. A 26-year-old woman presents to her primary care physician for evaluation of her vision, which has deteriorated over the last year. She's noticed increasing difficulty driving at night, especially in reading signs and detecting cars on her left or right. She has no associated eye pain or headache. Past medical history is significant for anxiety, which is managed with counseling. Family history is significant for progressive blindness in the patient's biological father by the age of 40. She takes no medications. Vital signs are significant for a BMI of 21 and a blood pressure of 118/76. Physical examination reveals moderate bilateral peripheral field deficits and decreased visual acuity compared to previous testing. Which of the following findings is most likely present on fundoscopy? A. Arteriovenous nicking, silver wiring, and flame hemorrhages. B. Bony spicule pigmentation with pallor of the optic disc. C. Hard exudates with capillary microaneurysms. D. Retinal whitening with a cherry red spot at the macula. Or E. Scattered diffuse hemorrhages with swelling of the optic disc. The correct answer is B. Bony spicule pigmentation with pallor of the optic disc. These findings are characteristic of retinitis pigmentosa, a disease that results in the progressive loss of rods and cones. Most cases are caused by an autosomal dominant mutation, and a family history of blindness is common. Symptoms usually begin with difficulty seeing in dim lighting, such as while driving at night, and progress to complete blindness. Answer choice A, arteriovenous nicking, silver wiring, and flame hemorrhages, is incorrect. These findings are characteristic of hypertensive retinopathy, which is highly unlikely in this patient who is normotensive. Hard exudates and cotton wool spots may also be seen. Answer choice C, hard exudates with capillary microaneurysms, is incorrect. These findings are characteristic of non-proliferative diabetic retinopathy. Rupture of microaneurysms may present with hemorrhage in these patients. Answer choice D, retinal whitening with a cherry red spot at the macula, is incorrect. These findings are characteristic of central retinal artery occlusion, which typically presents with sudden, painless vision loss. Answer choice E, scattered diffuse hemorrhages with swelling of the optic disc, is incorrect. These findings are present in retinal vein occlusion and are often described as blood and thunder. Similar to central retinal artery occlusion, vision loss in retinal vein occlusion is painless. Key learning point. Retinitis pigmentosa is characterized by progressive blindness due to loss of rods and cones, with bony spicule pigmentation and optic disc pallor on fundoscopy. Most cases are transmitted through an autosomal dominant pattern of inheritance.